even in terms of discharging patients, once you start getting an overwhelming amount of persons, recall that we were saying before, you need to get 2 negatives before you're able to be discharged from isolation, from quarantine, where you're going to be able to go back to work. That particular recommendation has changed in WHO, so that the recommendation actually mentions that the criteria may change. If you are not able to do testing, 2 negative tests, then if you're not going to be able to do that, if your lab capacity has been overwhelmed, then the criteria that you can use is for people who are symptomatic, people who had fever, flu-like symptoms, 10 days after the onset of symptoms, and provided they have gone 3 additional days without symptoms, which means no fever and any respiratory symptom, those persons may be able to go back to work. So that means that on average 13 days after you have started with signs and symptoms is when you would be able to go back to work if you are not able to test as a country with the 2 negative PCRs. And we checked in the region, and most countries have moved towards that. Some countries have even moved to 7 days after you were diagnosed. As long as you don't have any sign or symptom, people are going back to work. For asymptomatic cases, and again, this is WHO recommendation, 10 days after you test positive for SARS-CoV-2, if there is no sign or symptom, you can go back to your routine activities. Of course, the necessary precautions that will prevail in terms of physical distancing, wearing a mask when in the presence of others, and hand washing is what would routinely happen.